All right, I'm going to get us started because we are live on YouTube. So thank you for joining us again. It's Monday, April 20th, and today we will have statements from Dr. Hsiu-Li Wang, Acting Medical Officer of Health, Regional Chair Karen Redman, and we'll also have a statement from our CAO, Mike Murray, who will give updates on transit and childcare. So without further ado, I will pass it over to Dr. Wang. Hsiu-Li, if you could unmute yourself. Thanks.
Thank you.
Thank you.
Good morning. Thank you for joining us. I am sad to report that since yesterday, we have had 2 more deaths in our community. Both were residents in long-term care home facilities. Each person who has passed was someone's loved one. Each person will be greatly missed. I wish to express my sincere condolences to the families, friends, and caregivers of those who have passed. Regarding the outbreak at Forest Heights Rivera, we continue to receive testing results from Forest Heights. As of 7 p.m. last evening, there are now 101 cases among residents, 40 among staff, and sadly, 11 deaths. We expect to receive additional results this week for tests previously conducted, and testing will continue to occur going forward as appropriate. Strong outbreak measures have been put in place. This past weekend, Ontario Health's Waterloo-Wellington Health System Response Team, composed of non-hospital, hospital, and public health partners, actively worked with Forest Heights and Rivera on a plan to provide further support to the residents and staff of Forest Heights during this outbreak. More information on that will be coming soon. In regards to overall trends, there are currently 14 long-term care homes or retirement homes in outbreak. 3 long-term care homes have had their outbreaks declared over. Since Friday's update, there has been an increase in the number of new confirmed cases to 503 as a result of the expanded testing for priority groups, in particular in long-term care homes and retirement homes. We expect to continue to see significant increases in the number of confirmed cases in the coming days as a result of expanded testing. In closing, I would like to express my sincere gratitude to all the staff at long-term care homes and retirement homes in Waterloo Region for the crucial and incredible work that they have been doing. These are exceptionally challenging times for those who work in settings which are particularly vulnerable to COVID-19. You carry on with your work despite all the challenges with such care, commitment, and compassion. Thank you for your invaluable service. Thank you.
Thanks, Dr. Wang. I will pass it over to Chair Redman now. Go ahead, Karen.
Thanks, Bethany. I want to start today by expressing my sincere and heartfelt condolences to the people of Portapique and all of Nova Scotia for the heinous crime and the shock that has gone through our entire country at the senseless violence. I know citizens of Waterloo Region join me in offering our thoughts and prayers to the family of the victims. And also as an indication of our empathy with the people of Nova Scotia, all flags will be flying at half-staff in regional buildings. I also want to echo Dr. Wang's comments and sincerely thank all of the long-term care and retirement homes who are experiencing particularly challenging times. Our frontline healthcare workers and first responders are working tirelessly to keep us safe, and we're grateful for your service and for your sacrifice. Despite the difficulties of COVID-19 that has imposed on our lives, there are reasons to be grateful in Waterloo Region. Looking at things from a perspective with gratitude helps me stay positive. And if you're feeling overwhelmed, consider the following. We live in a community with skilled healthcare staff working 24/7 to keep us safe. We have essential workers who are continuing to do their jobs to ensure that we have what we need, from clean water to food, public transportation, and so much more. We live in a caring community that's looking to look after the less fortunate by way of donations and creating space for those experiencing homelessness, making deliveries to those who are in need or are homebound. Local companies have stepped up to create products needed to fight COVID-19, and some have donated PPE to our frontline workers, and we are eternally grateful for that. Citizens have found ways to support our businesses by buying local whenever possible. And the local economic organizations have come together to help struggling businesses navigate these uncharted waters of COVID-19. We're fortunate to live in a world where technology can inform us and keep us connected to our loved ones. And lastly, we have a community who is practicing physical distancing to slow the spread of COVID-19, and it's working. I'm grateful for everyone who is doing their part to help slow the spread of COVID-19. If you need information on services on COVID-19 programs, visit the region's COVID-information page on our website. Again, thank you for all you're doing to make sure that our community stays safe. Thanks, Bethany.
Thank you, Karen. Okay, last but not least, we'll turn it over to our CAO, Mike Murray. Go ahead, Mike.
Thanks, Bethany. So I'll provide an update on two issues. One is related to transit and the other is related to emergency childcare. So I think most people are aware today, further transit service reductions went into effect. So we've reduced bus service by about 25%, mostly through changing the frequency that a number of routes operate. So the overall hours of the day that the transit operating has stayed the same, but the frequency of a number of routes has been adjusted. Total reductions about 25%. So as we've done that, transit will continue to monitor the number of passengers on board buses to make sure that passengers are able to maintain appropriate physical distancing. One of the ways that that's going to happen is that bus drivers will monitor how many passengers are on their bus. And if a bus is about half to 2/3 full and unable to safely add more passengers, then bus operators will advise their supervisors. Supervisors will try to arrange an additional bus. And until the number of passengers on the bus comes back below about half to 2/3 full, that bus won't pick up additional passengers. But a subsequent bus will be sent out if possible to pick up people who might be waiting at bus stops. So that will continue, and GRT will continue to monitor how the service reduction is going. So that's transit. And in terms of emergency childcare, we got new directives from the province. I think it was about 8 o'clock on Friday night. The province expanded the list of eligible workers whose families, whose children are eligible for emergency childcare. So they expanded that list to include employees such as those who are working in shelters, developmental services, residential services, and others. So families of people working in those areas, as well as anybody who's in an essential or critical service, their families are eligible for emergency childcare. As a result, we're seeing increasing demand for emergency childcare. The region has applied to the province to open additional spaces for emergency childcare in 2 community-operated licensed childcare centers and through a community-operated licensed home childcare agency. So once approved by the province, those will be opened up very quickly. To date, in the emergency childcare program, we've received 210 applications for a total of 342 children. 94 children have been placed. 20 families are in the process of being placed, and 65 families are still waiting for placement. The new centers to be opened will help with that. And the remainder either withdrew their applications or weren't eligible for the program at the time. So children continue to be placed daily. Spaces are filling up, but there are still spaces available in the emergency childcare program. And if people are looking for more information, they can consult the community support section of the region's COVID-19 website. Thank you.
Great, thanks, Mike. I'm going to turn it over to the media for questions. Let's go with Ben first. Are you ready to ask your questions, Ben?
Yes, I am. Can you hear me okay?
We can.
Fantastic. Just a quick question off the top. How many long-term care homes do we have in Waterloo Region?
I don't have that number off the top of my head, but I can, we can get it for you, Ben.
Okay, I was just trying to figure out an official number. I appreciate that. Just for Dr. Wang as well, about this plan for Forest Heights that you mentioned, is there any amount at all that you can elaborate on that? Is there any sort of plan to move residents out of that facility, or?
Yeah, we'll have more to say on that shortly, but at this time, you know, what we know is Forest Heights is, you know, it is having to manage a very significant outbreak in terms of the number of residents and staff. And that is a significant load on any long-term care home. And so health system response teams have been put together by Ontario Health, and they're regionally based. So that's a relatively new initiative. But we do have one that's already been established for Waterloo, Wellington. And as you probably know, in Waterloo, we have a history of having very strong, very good collaborative relationships across partners in multiple sectors. So not only in acute care, but non-acute care, primary care, public health, etc. So over the weekend, this team came together and were in active discussions with Rivera, as well as the Ministry of Long-Term Care, who oversees these homes. And you know, there's a plan that's being put in place to further support Forest Heights while they are managing this outbreak. They are working very hard around the clock. Their staff are exceptionally committed. But we recognize, as you have seen in the last couple of days through our dashboard, the number of cases has significantly risen. And so it is come to a time when when the health system partners are working with Forest Heights and Rivera to offer additional supports.
Okay,
Further
thank you very
questions,
much,
Ben?
Dr. Wang. I do have a question for Mike Murray. I'm just wondering if you can speak to any new charges or fines for not obeying new rules. As well, is that up on the dashboard yet? I haven't seen it up there.
So two things. I don't think it's on the dashboard. So we'll look at whether we can. And I think our intention was about once a week, I was going to do an update on enforcement compliance charges. And so we're planning to do that, I believe, on Wednesdays each week.
Okay, thank you very much. No further questions right now.
Thanks, Ben. Okay, I'm going to pass it over to Joanna.
Thank you. Just wondering if you can tell me more about the outbreak at St. Mary's General Hospital. I think that's probably very concerning to the community because they're kind of hoping, you know, when they go into a hospital, there's not an increased risk of getting COVID.
Thanks for your question, Joanna. So as you know, hospitals are where there are many COVID positive patients because that's, you know, where they need to be cared for if they require hospital care. So it's actually not unexpected that from time to time there could be outbreaks that are declared in hospitals. Hospitals have a very strong surveillance system put in place specifically for that, to detect whether or not, there are clusters of cases that shouldn't have really occurred. Because hospitals are taking in patients with COVID every day, you expect that there's a certain number of COVID patients in the hospitals. But from time to time, there could be some additional cases that don't seem like they should have occurred. And in that case, the hospitals will investigate, as St. Mary's has done in this case, and they've determined that, there were a couple of instances where transmission likely occurred between residents, possibly from a resident to a staff person. And in that case, they acted quickly to make sure that they would put those wards under outbreak. They did that in consultation with us in order to ensure that, further enhanced measures are put in place. I think that they're doing the right thing, and they're doing a good job. And what I can tell you is that hospitals have very strict infection prevention and control measures in place so that they can, properly care for the residents and protect their staff. And I think it's not unexpected that this will happen in any hospital. I believe we have over 30 hospitals in Ontario that have outbreaks right now of COVID, just because of the fact that they are constantly taking in patients with COVID. But the important thing is that they have a strong surveillance system for this type of thing, and they do. And when they detect it, they act on it, which they've done.
Great. I think that's all my questions for now.
Great. Thanks, Joanna. I will pass it over to Kate from CBC.
Hi, good morning. This sort of might be something that Dr. Wang will address later, but with Forest Heights or any long-term care or retirement home, is there a point ever where public health or this health team would step in and take over the home, or would that be a provincial thing?
The objective is to really ensure that the home has what it needs to be able to properly manage the outbreak. And, Forest Heights has been collaborating with us. We've had daily calls with them, and the Ministry of Long-Term Care has been involved, as well as people from Bravera. And, they have made great efforts to continue to do everything that we've asked and to take care of their patients. I'm sorry, it's their residents. That said, whenever there's an outbreak that's significant, very significant in this case, it's understandable that a home may need additional supports. And that's why these Ontario Health teams have been put in place. And, these are one of the instances where we feel that it's important to see whether there's anything additional that we can do for Forest Heights. And those discussions are actively ongoing right now, and we'll have more information later. But the purpose is really to ensure that they can do what they need to do to take care of their residents. There's already oversight that's being provided by the Ministry of Long-Term Care. So that's the goal.
Great. A bit of a different question. The dashboard shows that about 65% of the cases are women.
Oh, yeah.
Can you kind of address why that's the case?
Yeah, no, I believe that is a reflection of the preponderance of women in the healthcare field, and also greater numbers of women that are older, in the long-term care homes and retirement homes. So, so that's why I believe there's a preponderance of women that have been diagnosed with COVID.
Okay. And this is either for Chair Redman or Mike. I know that construction has continued on things like the roads and sewers and stuff like that, but what about the bus facility in Waterloo, the new one?
Yep.
Mike can take that.
Yep. Thank you. Work continues on that, Kate. Big, important project, critical service, and yep, work is underway.
Okay. I'm good. Thank you.
Great. Thank you, Kate. I will pass it over to Adam Jackson. Are you there, Adam?
I am, thanks. This is a question for Hsiu-Li. We've heard from a couple PSWs that work in long-term care homes that they've been directed that they can return from a positive COVID-19 diagnosis 24 hours after being asymptomatic. Our understanding is that the provincial directive is 72 hours. Can you just kind of clarify what the process is for people who have tested positive and their plan for return to work?
Thanks, Adam. That's a very good question. So the provincial guidance on that has been frequently updated. So the latest update is that if someone who is asymptomatic has tested positive, and if the employer deems that under exceptional circumstances they are critical to the continual operations, then they can return to work 72 hours after. And they have to be fully in PPE gear as appropriate, and they're screened, and all the kind of precautions that the ministry has recommended for such workers who are asymptomatic, but who have tested positive in the case of a critical need for staffing at the homes. So that's the latest. It's 72 hours.
Thank you. Follow-up question is I've seen quite a few people gathering, maybe a bad word, but taking their loved ones out of their homes. Is this something that you have seen in long-term care homes in the region? And if so, is it a recommended step? Do you think at this point it's appropriate for families to take their residents out?
I actually don't have the stats on that. I have heard anecdotally that some families, have either wanted to or looking into this. I think this is a very, very challenging time for the entire sector, and it's understandable that it's very stressful for families. Those decisions are personal decisions, what we do is we work to support the homes to ensure that they are putting in place the latest and most appropriate guidance with respect to outbreak control and preventing further spread. And we also work closely with the Ministry of Long-Term Care, or if it's a retirement home, the Retirement Home Regulatory Authority, to make sure that there's collaborative work and oversight over these homes, and so that's what we're doing, and I know that the homes are working very hard to do whatever is being asked of them, and these are very stressful times for all involved.
And one more, if I can, at Forest Heights, with the large number of employees that have tested positive, I guess what's the status right now in terms of staffing? Are they able to keep adequate staffing at this point? Are they calling in help, or what's the current situation there?
No, that's a good question. So Forest Heights would have the latest on that. However, as I mentioned, with the number of cases, including the number of cases among staff, it would be challenging, especially in these times, to make sure at all times that they have appropriate staffing. So that's one of the things that the Health System Response Group is looking at with Forest Heights, in order to make sure that if need be, you know, we can try and help them shore up their staffing. It's definitely an issue for every home, actually, probably in Ontario, but especially for homes that, you know, do have staff that are going off because they're ill or they've been tested positive. So it's something that, you know, the health system partners are looking at closely with Forest Heights, again, to make sure that they can continue to have sufficient staffing.
Thank you.
It is a challenge for sure.
Thanks, Adam. Okay, I will now pass it to Nicole from CTV. Nicole, go ahead.
Hi, good morning. Last week, Minister Fullerton, when she spoke about this, you're calling it the Health System Response Group. Minister Fullerton last week referred to something as a SWAT team. Would this be what she is suggesting, the Health System Response Group? Would that be the SWAT team she was talking about?
Yeah, that's not the name that we've been given officially. Yes, there are regional teams that have been asked to be put together by Ontario Health, and that direction does come straight from the ministries, long-term care, health, Ministry of Health, et cetera. They're collaborating together. So yeah, so this is definitely one of the purpose of those teams, is to, you know, get together as a region, all healthcare partners working together to look at what can we do to provide further assistance to homes which are, in particular, homes which are experiencing outbreak. So yeah, that is a follow-up to that action plan.
Okay, and with the increase in overall cases, while we've seen hospitalization sort of stabilize, can we expect hospitalizations to go back up again?
Yeah, it's not possible to predict, but we do know that from a community transmission perspective, the community transmission has really slowed down. So, you know, even though we get more positive results, but that's because we're testing more in long-term care retirement homes and now other groups, you know, vulnerable population groups or those who care for them. And now, as of last Friday, essential workers. So we're going to get significant increases in our number of cases that are confirmed positive. Our curve's going to go up, but actually that reflects the prioritized groups that are having more testing done among them, while the community cases that we're getting, you know, has gone down. And that's really, I think, a function of the measures that we've put in place, you know, closures of businesses and social, or rather I should say physical distancing of people staying at home. You know, the community in Waterloo region has really been listening and really, you know, following those recommendations, and that's really helped us slow down the community spread.
Okay, that's it for me.
Great, thanks, Nicole. I think our last member of the media is Damon, so I will pass it over to you, Damon.
Thank you and good morning. I'm going to start off a question for Dr. Wang. At the beginning of the outbreak, well, I guess the epidemic, Public Health was working with the Mennonite communities, and they sent over officials to give them information on the virus. Has there been any more follow-up and any more, I guess, knowledge brought to these communities, more up-to-date information?
Yeah, so so we are working with Sergeant Kelly Gibson of the Regional Police Service. She's a part of the Rural Realities Network. So she mentioned to us that she has been in contact with the Woolwich Community Health Center, and they have reached out to other groups as well. And we are also aware that the townships have done some of their own communications to the Mennonite community. So, you know, we're going to continue to work with our partners, Waterloo Region Police Services, as well as the Rural Realities Network, Woolwich Community Services, Mennonite Central Committee, Woolwich Community Health Center, and others. Yeah, so that's the update that I got.
Okay, great. My next question is for Mike. I know in places like Guelph and Belleville, they've switched over community centers to host the homeless during these times, or switched over for testing facilities. Can we see that coming for the region anytime soon?
Well, Damon, I think as you know, we did open a new overflow shelter in the A.R. Kaufman YMCA. So that's, equivalent to repurposing a community center. So here was, the Y repurposed for an overflow shelter. There's also work going on to look for additional space for sort of daytime drop-in kinds of programs for street involved people, both in downtown Kitchener and in Cambridge. So yeah, there's work going on to look at, what kind of physical space is needed for that. And then as significantly, how to staff them. And often it's the staffing that's more of a challenge than finding the physical space.
Okay, and just another question for Mike. Have any of the bus drivers voiced their opinions regarding driving during these times, and how are they adapting to the concerns to protect themselves and their passengers?
Yep. So one thing I would say in general is we've had just terrific dialogue and engagement with our bargaining units over the course of this whole pandemic. I think we have 7 different bargaining units, including transit. And so typically a lot of the discussion goes on between the region, our transit management and HR, and the union executive. And often people will voice concerns either through the executive, through joint health and safety committees. But overall, I think there's been great collaboration. I think the drivers feel like, we're doing everything we can to keep them safe. The move to rear door boarding early on, I think was really appreciated by them. This latest measure to make sure that passengers can keep enough physical space between themselves, that's another piece of the puzzle. So yeah, overall, I think, it's a challenging area, but overall, I think things are going pretty well.
Okay, thank you. That's all my questions.
Great. Thanks, Damon. Okay, I'm going to give everyone one last chance to ask questions. If I missed anyone, I see Kate waving. All right, Kate, you got one more.
Thank you. Just for Dr. Wang, do we have a sense when we look at these cases in long-term care homes, how the cases got into the homes? Like, is it a case of maybe there was community spread, like family members who had the sniffles and didn't realize that they had COVID, or is it staff members bringing it in? Is that at all part of like what you guys are looking at this point, or is it all just sort of, let's figure out how to help people?
Yeah, no, it's a good question, Kate. So it's been a mixture. Sometimes it's a staff person who tests positive first. Sometimes it's a resident. And we always try to find what the source is as part of our investigation. That said, it's not always possible to be sure because there is community spread of COVID-19. But in long-term care homes, there is very strict surveillance and very strict measures to try to prevent COVID from coming into a home. So as you may remember, the ministry instituted an essential visitors only policy. There's screening before people come in. And if there's one case that's detected either in a staff or a resident, they are right away in outbreak. That is very strict, much stricter than normal in terms of outbreak management. It's a mixture, and we're not always certain, but in terms of how it actually got in. But I can say that with the types of measures that have been put in place, these are very strong measures in order to try to minimize further spread going forward. That said, as we've seen in our homes, as is the case elsewhere as well, sometimes, once it gets in, it spreads very quickly. In those homes, it can reach a lot of residents and staff very quickly. But again, the key thing is to continue to make sure that we put in place the appropriate precautions. And now with the expanded testing, that's going to be another tool in the toolbox to help us manage these outbreaks.
Great, thank you.
Thanks, Dr. Wang. Okay, I don't think that there are any more questions, so I'm going to, I see Ben. Go ahead, Ben.
Thanks very much. This is just a quick question for Dr. Wang. Do we know any particular reason why cases spiked by 75 on Saturday, or was that just an anomaly?
More testing. Hsiu-Li, unmute.
Oh, thank you. Sorry. Thanks for the reminder. Long-term care homes and retirement homes, there was expansive testing done since late last week, since we were able to expand.
Cool. I figured that was the case, but I appreciate the confirmation. Thank you.
Okay. Thanks, everyone. Just want to reiterate that we really appreciate you helping us share this important information with community members. And we will see most of you probably on Wednesday. So thanks again.
Thank you. Thank you.
That's all.
Have a good day.